of this show.
Yeah.
I don't want you ever embarrassed if you find something that works for you, just because we didn't know about it. I made a big promise to you folks when we started the program. I said, we're going to change medicine today. This is a novel idea, and I'm proud that we're able to uncover it and describe it to you guys, but what's going to change medicine is not me talking about it. It's going to be you not being embarrassed to talk to the folks that are governing you in terms of your health, that are giving you advice, that are trying to heal you. You need to tell your doctor. Do you know why? Because every other patient that doctor sees is going to benefit because you were willing to put your hand up and say, you know what? I was having bad pain. I wasn't getting relief. The medications, the injections, the operations, they weren't working for me. I want to try this new therapy out. And you know what? It worked for me. Please share it with other people. That's how we learn in medicine. I'm asking you to help us. I'm asking all of you to play a role in improving the care we give you. If you go back to your doctor and tell them you did this and it helped you, they're going to be curious about this.
Okay.
And I got some tips for you on how to do that. Dr. William Pollack treats himself with magnetic therapy and recommends it for his patients. He's a family physician and a former professor at Johns Hopkins. So Dr. Pollack, how can people know they're actually getting a device that works?
Well, obviously, if it's FDA approved, that's easy, because then it's approved for a certain indication. Most devices that are used today commonly are over the counter. They don't have any specific backing for them. So sometimes the websites have their own evidence, and otherwise you're going to have to do some internet work finding evidence for them.
I just want to point something out to everybody. Dr. Pollack is an advisor to patients and to companies and universities. And the products that he talks about, he gets paid for. But we're not talking about any of those products in the show today. But you are a world expert in this area, so thank you for making time to visit with us. So Erica's here. She's been wearing a knee wrap that's FDA cleared for postoperative swelling and pain. Hey, Erica, how are you?
Hi, how are you? Nice to meet you.
Oh, it's very attractive.
Thank you.
So how's it feel?
It feels great. When I have it on, the pain decreases significantly.
This is a picture of what it looks like from the outside. Pretty straightforward. But if you look on the inside, take that outer wrapping out. Inside, there's those yellow coils. They actually pass electricity through those. That generates an electromagnetic wave that pulses into the joint, which is why, in theory, will have a real impact. So, Dr. Paul, talk to us about a device like this. This is brand new. Why would a patient try it?
This is very good for pain management. This particular device is FDA approved for knee pain of almost any kind, including arthritis of the knee. It produces a very high frequency magnetic field plus heat at the same time. So you're getting two benefits in one device. Most devices are either plain pulse magnetic fields or plain heat, but they don't combine both of them. So this is very effective. It reaches deep into the tissues of the knee.
But I do like the idea that it's FDA approved. So, we found that the best treatments are these pulsed magnetic therapies. These are moving magnetic fields. They target very specific sites where you're having pain. I want you to go to our website, and I want you to print off a one-page explanation of magnetic therapy for pain. I've made it really straightforward. Your doctor's going to understand this note, and you're going to understand it too. I want you to take this paper to the people who you're trusting with your care, and I want you to talk to them about it. But here's the big deal. You guys are going to go out there and change the way we take care of pain by being the first one that doctor treats, but you will not be the last. There'll be many other patients who'll get that therapy because you guys were brave enough to go first and talk about it. Does that make sense, everybody? Okay, thank you.